Hello everyone, welcome to my YouTube channel. I am Nurse Patience and today we'll be talking about how do I reduce my risk of cervical cancer. First, it will interest you to know that cervical cancer is the cancer or malignant tumor of the lower outermost part of the uterus. So the cervix is at the entrance of the uterus and it can also get infected with this malignant tumor. But cervical cancer affects women from age 10, 30, and even above. It is a topic of concern to the women population, and that's the reason why I have come up with this video content today. So if you're a lady watching this video, you need to sit back. This video is for you. Whether you are not up to the age of puberty, or you are at puberty, you're an adult, you're an adolescent, you are a mother, you also need to look at this video so that you'll be able to help educate others, other females like yourself, in your workplace, in school, in gatherings, because this topic is a very important one. The number one main cause of cervical cancer is the human papilloma virus. Human papilloma virus, also known as HPV, is a very deadly virus that affects women, and for most individuals it is gotten through sexual intercourse, so it is a sexually transmitted virus. The other cause or risk factor of cervical cancer includes: one, having multiple sexual partner. Like I told you, if you stick to a single person and you and that person are having intimacy, if that person is having a HPV infection, it is more easier for you to detect than when you have multiple people you are actively sleeping with. This would only increase your risk of coming down with cervical cancer, because first, cervical cancer starts with the infection with this virus, which is the human papilloma virus. And this human papilloma virus have a lot of streams. For the stream that causes cervical cancer is 16 and 18, and even stream 14 too can also cause it. There are other streams of human papilloma virus, but for the course of this video, it is the stream 16 and 18 that the major ones that cause cervical cancer. Having multiple sexual partner increases the risk of an individual of coming down with cervical cancer. Another is the age at which an individual have their first sexual contact. For most individuals, or for most female, you see some of them at age 9, at age 12, or even those ones that have been abused. Individuals that are subject to abuse might have a higher risk of coming down with cervical cancer, because the age at which an individual first have their sexual intercourse is a major determining factor or whether or not that individual will come down with cervical cancer. Also, smoking is a major risk factor for developing cervical cancer. We all know that smoking is one major risk factor that is common in all other kind of cancer, and to also increase the risk of an individual coming down with breast cancer, an individual coming down with prostate cancer. It would also increase the risk of an individual having cervical cancer. So the other risk factor could include other sexually transmitted infection. Individuals that have sexually transmitted infections like gonorrhea, chlamydia, syphilis, their risk of coming down with cervical cancer is also higher, because if these infections are left untreated, they have a way that they dampen with the mucosas of the cervix. It changes the cells of the cervix, and from there it would cause this rapid proliferation that is common with cancerous cell, and from there metastasis will occur and it will just spread to the other parts of the body. Another risk factor for an individual coming down with cervical cancer is an individual whose immunity is compromised, suppressed individual, an individual with a weakened immune system. Individuals with, say, HIV or AIDS have a higher risk of coming down with cervical cancer. Why? Because at this point their body cannot fight infection. You see that most people living with HIV and AIDS, they tend to come down with other kind of diseases, because at this point their body system cannot combat infection, and it rather give way or pave way for more infection, opportunistic organisms to come into the body and further reduce this immune suppression in them. So now we'll move straight to how do I reduce my risk of coming down with cervical cancer. All those things I've stated earlier are the causes and the risk factors for an individual coming down with cervical cancer. So if you want to reduce your risk of cervical cancer, first what you need to do is, how do I reduce my risk for coming down with cervical cancer? The first is HPV vaccination. Most of you must have not heard of HPV vaccination. Like other vaccination an individual can have, you can also get vaccinated against human papillomavirus. This vaccination is only going to work before the first sexual intercourse or after the first sexual intercourse, because at the point when infection has set in, no matter the kind of vaccine you take, it will not work at that particular point. So it is very important that before you start having sexual intercourse, you try and get vaccinated against human papilloma virus. And these things are in the hospital. You go, all right. So the next point is cervical screening. For the cervical screening, it helps the individual know what the cervical screening does. Is at this point you go to your healthcare provider and they inspect the cervix. This is a preventive method, or will I say approach, to reducing your risk of coming down with cervical cancer, because if the cervix is being inspected, the cells can be taken from it and they might be visualized under the microscope. And if there's any abnormality in these cells, at this point the physician will know what to do, because cancers can be treated and can be cured when they are being seen and attacked from a very early age. So when you do cervical screening, these routine checks of the cervix, it would reduce your risk of coming down with cervical cancer. Next approach to reducing your risk of coming down with cervical cancer is delaying the first intercourse you'd have as a lady. It is very important, because you see a girl of 12 years is already sexually active. A girl of 8 years is already sexually active. And I don't know, I'm not trying to blame their parents, but then I feel mothers and parents generally have a great role to play in the life of their daughters. As a mother watching this video, or as a young girl who will be a mother someday, you have to teach your children about the dangers of going into sexual intercourse at a very early stage. One of the danger of going into sexual intercourse at a very early stage is one, unwanted pregnancy. And with unwanted pregnancy, the child might want to go and abort, which is a criminal offense. With abortion, that's not the only thing. Look at cervical cancer. What if the guy that impregnated her has HPV infection and have transmitted HPV infection into the life of that little girl? Then this would also grow in the nearest future to become cervical cancer. So we need to educate our young girls, our female children, about the importance of delaying first sexual intercourse. It is a very major step on how to cope or reduce the risk of an individual coming down with cervical cancer. The next is ensuring that any sexually transmitted and infection an individual have is treated with seriousness. If you have any STI, I am not judging you, but it is very important that you get treated once and for all. You try and follow your medication, you take the right antibiotic that is required for you to take at the right proportion and when necessary, so that you try to reduce the rate of infection spread, so that it won't matured into something else that you would end up regretting. The next is quit smoking. For breast cancer, for ovarian cancer, for lung cancer of the lung, for prostate cancer, mention the all other kind of cancers you know. Smoking is one major risk factor for each of these cancers. You can actually reduce your risk of cervical cancer by quitting cigarette smoking or any form of smoking that you do, which would do you good. Then the next is safe sex practice. By safe sex practice, for an individual, cervical cancer is caused by human papilloma virus, usually transmitted via sexual intercourse. Instead of going direct contact with individuals who is infected with HPV virus, all you need to do now is use of barrier method. You use condoms. With this, you tend to prevent or reduce your risk of coming down with cervical cancer and getting infected with human papilloma virus. The next and the last step is try to stick to one sexual partner. The major risk factor of coming down with cervical cancer is multiple sexual partner. And when you have them plenty, you won't know where your problem is coming from. So what you need to do is stick to one person. With this, you would be able, and also use barrier method when having intimacy with such an individual until the status of that individual is confirmed. Then you would be able to go direct with such an individual. I hope this video has been helpful to you. If you've not subscribed to my YouTube channel, please kindly hit the subscribe button. You're a returning viewer, please hit the subscribe button, like this video, and also drop a comment on it. Thank you.